The objective of this video is to review open cricothyrotomy. Of the various techniques that have been described to do open cricothyrotomy, it's my preference to use the bougie-assisted technique. I like this technique because it's very simple, it requires minimal equipment, and wherever you're working in any emergency department or pre-hospital setting, you're going to have easy access to a scalpel, a bougie, and a number 6 endotracheal tube. The bougie has the added advantages of us being very familiar with it from using it with direct laryngoscopy. And when it's used to be placed in the airway with an open cric, you're going to likely feel the tracheal rings and you're going to feel it stop at the carina, thus confirming entrance into the airway. If you use this method, you're less likely to create a false track. So at the start of the procedure, you're going to want to take a few seconds to position the patient and prepare your equipment. It's important to note that the location of the cricothyroid membrane is variable depending on the position of the head and neck. You can see that the cricothyroid membrane there could be in a different position depending where the head and neck is placed. The ideal positioning for this procedure is slight extension of the neck with the head in the midline position. You could have an assistant hold the head and neck in the correct position while you're performing the procedure. You're going to landmark the position of the cricothyroid membrane by first locating the thyroid cartilage, the cricoid cartilage, and then the membrane lies in between. If this anatomy isn't visible due to obesity or trauma or whatever condition, you can approximate the location of the cricothyroid membrane by the four-finger method. 4 fingers up from the sternal notch is going to approximate the position of the membrane. You're then going to prepare your equipment for the procedure. Line your equipment up in the order that you're going to need it. Scalpel, bougie, number 6 endotracheal tube, syringe, and ties. It's important that the equipment is very close to where you're doing the procedure and is easy to reach for. It's my preference, being right-handed, to be on the left side of the patient. I feel that this allows more of the procedure, the scalpel, placing the bougie, and placing the endotracheal tube, to be done with the dominant hand. Thus, if you were left-handed, ideally you'd be performing the procedure from the right side of the patient. So skin preparation and local anesthetic are optional and often not going to be practical with the procedure. The procedure starts by stabilizing the airway with the left hand, locating the cricothyroid membrane with the index finger of your left hand. Take your scalpel and make a 2 to 4 centimeter incision along the midline, centered over the location of the cricothyroid membrane. You're going to cut down through the skin and subcutaneous tissue. And of course, you're going to expect there to be bleeding at this point of the procedure. Because of the bleeding, the location of the cricothyroid membrane is going to be done by palpation, not by visualization. Locate the cricothyroid membrane and make a 1 to 2 centimeter horizontal incision through the cricothyroid membrane. After the horizontal incision through the cricothyroid membrane, place your index finger into your airway. Advance the tip of the bougie into the airway. It should advance with minimal resistance. You may feel the tracheal rings. Advance until it stops at the carina. Your number 6 endotracheal tube is then advanced over top of the bougie. Into the airway. And it's placed at a depth of 15 centimeters in an adult. And then remove the bougie. Inflate the cuff with 10 mils of air. and secure the tube in place with tube ties. The other thing I wanted to review is some of the equipment that's available in the open cricothyrotomy kits in the Calgary Health region. As mentioned, there's been many different techniques described to do an open cricothyrotomy, and two pieces of equipment that you'll find in our local kits are a tracheal hook and a trousseau dilator. These are designed to keep the airway open as you place the endotracheal tube into the airway. So the way that these would be used is after your horizontal incision through the cricothyroid membrane, the tracheal hook would grasp the cricoid cartilage, pulling towards the feet, and hold the airway open as the endotracheal tube is advanced into the airway. Alternatively, after the horizontal incision through the cricothyroid membrane, the trousseau dilator can be used to maintain the opening into the airway and aid placement of the endotracheal tube. So whichever method you choose to perform an open cricothyrotomy, whether it's the bougie-assisted method or another variation of this procedure, which may or may not use the tracheal hook or trousseau dilator, it's important to practice it regularly. A good way to practice this procedure is using pig's tracheas.